The IN.PACT Global study was a very large multi-center trial that included over 1,500 patients. And it consisted of a complex real-world patient population. And in this population, there were 156 patients with critical limb ischemia, divided over Rutherford 4 and 5. When you look at the lesions of these patients, they had a mean lesion length of 40 centimeters. There was a 41% total occlusion rate, and 77% of them had calcifications. When you compare these anatomical figures with the patients that were treated for intermittent claudications, there were more patients with restenosis, the lesions were longer, they were more calcified, and more often the popliteal artery was involved. Well, what we hope is to provide a more durable result for these patients, with less reinterventions in this vulnerable patient group. And the frailty of this population is also shown in this study by the observation that at 4-year follow-up, more than 30% of our patient cohort had died. Another important advantage is that with the use of drug-coated balloons, the need for stents will be lower. And particularly in the popliteal artery, the incidence of stent restenosis remains very high. In this population, the provisional stenting rate was only 23%. Well, there is in fact two major outcomes. One of them is the clinically driven TLR rate of 65% at 4 years. When you compare this to the patients with intermittent claudications, they had a freedom from TLR at 4 years from 75%. And the most important outcome is a freedom from major amputation rate of 97%. Well, the main message of our study is that it's safe and effective to use the IN.PACT Admiral DCB in this clinically complex CLI subgroup, with a freedom from clinically driven TLR of 65% and a remarkably high limb salvage rate of 97% through 4 years follow-up.